Welcome back to Daniyal Ultrasound Clinic. Here is Dr. Munir Abasi once again. Today we are going to discuss intestinal perforation, which is the most common pathology we receive time and again. So I thought it's suitable to repeat few things which are very important because the intestinal perforation is quite tricky to pick up on ultrasound. But there are some well recognized features. So let me describe a few features that indicate the presence of intestinal perforation. Uh, First of all, you will you will see free fluid. Here is the this is the ultrasound of the abdomen, lower abdomen. Initially, we are beginning from the lower abdomen because due to the gravitational force, the fluid accumulates usually in the lower abdomen and in the hepatorenal angles. So here is the urinary bladder filled with fluid showing mild amount of free peritoneal fluid. I will tell you later the consistency of the fluid, aside peritoneal fluid, but initially let me describe all those things which lead us to the peritoneal, intestinal perforation. So here is the free intraperitoneal fluid, and there are also echogenic foci. These are echogenic foci with reverberation artifacts. Just entry to the liver. They are usually found entry to the liver or under the abdominal wall. So these are reverberation artifacts. Here are you see, and there is also another finding that there is loss of normal peristalsis in adjacent bowels. So I can show you here. There is loss of normal peristaltic activity, and but sometimes you can find gut walls thickened, but here gut walls are thickened and few are not. So next picture is realized here. Now these ultrasonic features, they suggest intestinal perforation with free peritoneal fluid and free intraperitoneal air. Sorry. Now let me describe, as I told you, that intraperitoneal fluid, consistency of free intraperitoneal fluid. Here this is just we are going to the lower border of the liver where we have accumulated fluid. You see here. This is the lower border of the liver. Here is the liver, but this is lower area, but near the lower border of the liver. The fluid is complex fluid here, showing complex picture. It is not definitely anechoic because it contains echoes, and there are certain strains which can be seen in the fluid. Here you see there are strains. This indicates organization process. This is because of the intestinal perforation that fluid is accumulated there and in the lower abdominal area. So here are also other pockets of fluid in the peritoneal cavity, but the guts, they do not show real peristalsis, but there is to and fro motion of the intestinal contents. This is a typical classical picture of intestinal perforation where activity is either decreased or absent, but intestinal contents, they show to and fro motion. So the key sonographic features, as I told you, there is free intraperitoneal air, free intraperitoneal fluid, abnormal looking bowel loops, maybe thickened edematous or aperistaltic, and other indirect signs are that there would be localized abscess or phlegm and distended proximal bowels secondary to obstruction. But as I told you, certain features are really important to understand to reach at the diagnosis of intestinal perforation. Here are other guts which are showing to and fro motion, but real peristaltic activity is decreased, quite decreased. Almost there is no activity. So this is liver also. It appears normal in size and showing starry sky pattern. We beware of this thing that liver shows decreased echogenicity because of the reaction. This is reactionary changes. These are reactionary changes in the liver. They are not because of the hepatitis or anything like that. So we have to be really careful. So liver is about 13.2 centimeters. This is gallbladder. This is right kidney. Similarly, if we go to the left side, here is the left kidney. This is the spleen, which appears normal. So this is a typical case of intestinal perforation because patient is feeling uncomfortable and is in severe pain. So we have to stop here. That's all, guys. Thank you very much.